Well, we begin today with a major ruling on COVID vaccine mandates right here in New York City.
That's right. A federal judge has temporarily blocked public schools from enforcing a vaccine mandate for teachers and faculty, a mandate that was supposed to go into effect today. The federal appeals court granted the halt on Friday, kicking the decision to a panel of 3 judges for review. But the local teachers union says thousands of teachers and staffers could walk off the job if the mandate ends up going forward. Meanwhile, New York State officials are preparing for a massive health care worker shortage as a vaccine mandate for them goes into effect today. Workers who are unvaccinated will now be fired. New York Governor Kathy Hochul is preparing to call up the National Guard to help fill those gaps if that happens. We have a top-notch team to break this all down, including NBC News correspondent Cal Perry and NBC News medical contributor Dr. Natalie Azar. But first, let's go to NBC News correspondent Rahema Ellis, who joins us from outside the Harlem Hospital Center in New York City with more on these vaccine mandates. So, Rahema, today was the day that New York teachers and staff were supposed to have received at least 1 dose of the vaccine. So what happens now that this vaccine mandate has at least been temporarily blocked?
Good morning, Joe. What happens now, according to the city, is they hope that those teachers and those in the staff with the Department of Education who have not yet been vaccinated will go ahead and get that vaccine. The city administration feels pretty confident that they're going to win this court ruling and have it overturned and have this lifting of this temporary injunctions that's put it a stay, if you will, for the time being on this mandate going forward. Who are we talking about here? Take a look at some of these numbers. We're talking about essentially 150,000 workers with the New York City Department of Education. Of that, about 81% of all staff have received at least 1 dose of the vaccine, and 87% of teachers have received at least 1 dose of the vaccine. But they are insisting that they want 100% in this city. The mayor says it's imperative if they're going to make certain that they can keep all of the students and the staff as well safe from this vaccine. So they're continuing to push for this to go forward. Joe?
So, Rahema, we've been reporting here for months how many teachers felt like they weren't fully being protected from COVID in the classroom. So why are we seeing some of this pushback now from some teachers against a mandate, especially since other vaccines are already mandated before the start of the school year?
You're right about those other mandates. You can't have your child go to school unless they have a polio, measles, a mumps, a chickenpox mandate. But those have been, vaccine I should say, but those have been in place for decades, Joe. What parents and some teachers are concerned about right now, particularly since we're talking about teachers, they're concerned that this vaccine for COVID is not decades old, but it is recent, and they're not as comfortable with it as they are with those other vaccines that they are required to have. But listen to what the lawyer for the teachers union says about this whole issue of to get vaccinated or not to get vaccinated. Take a listen.
Quite many of them are not anti-vaccination. They're anti-mandate. I think the true thing that unites them all is that they're the only municipal workers in New York City that have been forced to get this vaccination. And they're the only school teachers in New York State that are being forced to get this vaccination. The governor came down with an edict. The rest of the teachers in New York State can get the testing option. That's all we want for our clients also.
So while they're holding fast on that, these two sides are at loggerheads, if you will, and the courts will have to decide all of this. As you point out, they could take this up as early as Wednesday or maybe even earlier than that, because certainly the teachers as well as the city, they're pushing. Teachers want that mandate to be removed. The city wants it to be enforced. Joe?
Rahema, you're standing in front of a hospital. That's because today is also the deadline for statewide hospital workers to be vaccinated. So is New York prepared to handle a potential shortage of healthcare workers, knowing many won't meet the deadline to get vaccinated by today?
The governor of New York says she absolutely is, and she's standing really firm on this, and that to the point of saying no vaccine, no work, and no unemployment relief for those who do not get vaccinated. In addition to that, she says she's prepared to declare a state of emergency where she can call out the National Guard, as well as call on healthcare workers from other states and other countries to fill the gaps if there end up being any shortages in health care. Joe?
All right, Rahema Ellis reporting from New York. Rahema, thank you.
As the Delta variant continues to spread across the country, one region in Texas has achieved a major milestone against the pandemic. El Paso County officials say they've reached herd immunity against COVID-19 after more than 75% of the city's population became fully vaccinated last week. NBC News correspondent Cal Perry joins us now from downtown El Paso with the very latest. And Cal, we've heard so many stories about Americans with vaccine hesitancy, especially in some regions there in the South. But in El Paso, over 75% of the population now fully vaccinated. Why do you think things are different there?
Yeah, I think it's a number of things. One, here in El Paso, you have a very strong community organization. This is a town and a city that is an international city. It is sort of married to Juarez. It is sort of one of those cities that is an international city in America and deals with the border crisis on a daily basis. So there's a very strong sort of community here that people were able to tap into, specifically local leadership. The other thing that happened in El Paso, and folks will remember this, it went through a horrible time last winter. There were those temporary morgue trucks that were in hospitals, and for a lot of people, including Dr. Alozi, who you're going to hear from in just a second, he says it was that pain in the community that forced a lot of people to get vaccinations. Take a listen.
There was some data last year that actually showed if people were worried about COVID or they were planning to get a vaccine, it's because they knew at least one person that had either been sick or died. And so in this community, it's a very tight-knit community, lots of multi-generational homes. People knew people that got sick. People knew people that died. And so that was a catalyst for them to go get it.
And because so many people were involved or connected to the tragedy, we saw those high number of people willing to be vaccinated, and we've seen those really impressive numbers now, Vicki.
Yeah, really. Cal, the impact of the county's high vaccination rate is really evident in the amount of cases they're experiencing each day. Just take a look. We're going to put a graph up showing just how low the number of new cases are in El Paso compared to the rest of Texas. Is this what it looks like when you have herd immunity in a community?
Yeah, now not everyone is going to call it herd immunity. A lot of people are taking an issue with that term, especially when you look at some of the surrounding areas not being as highly vaccinated. The state of Texas, for example, is just over 50% vaccination. But what does vaccination buy you if it's over 75%? Well, compare El Paso to the state of Texas. El Paso has a 6% positivity rate. The state of Texas has an 18% positivity rate. El Paso has about 7% of its hospital beds, their capacity for COVID patients. In the state of Texas, that's 20%. It is very taxing on the healthcare system in the state of Texas, whereas here in El Paso, things are relatively easier because of that vaccination. Once again, take a listen to Dr. Alozi.
We paid a heavy price last year, that October to December period where we lost a lot of lives. NIH estimates that we probably had 50 to 60% of the city already infected, plus the fact that we're the best city in Texas in terms of vaccination. So I really think, and I've said this a number of times, that sort of protects the city, forms sort of a halo effect in a sense, if you want to use that term, as the amount of people and the amount of immunity that we have.
The hope is that that halo effect, as you heard there from that infectious diseases specialist, will last for another few months, at least until we start having more and more of that booster conversation, Vicki.
Yeah, Cal, that's interesting. And herd immunity is a tricky term. We're still waiting now on approval of a COVID vaccine for children. Some are saying it could come as early as October. Do health officials in El Paso think that they can protect the younger population there until those vaccines arrive because of this high rate, over 75% of fully vaccinated adults there?
Yeah, it's that halo effect, right, that they're hoping and they're seeing evidence of, especially in hospitalizations being so low, that children are being protected. For one more time this morning, Dr. Alozi.
Of immunity, both virus-driven and vaccine-driven, that a lot of people in this community already have protection against the Delta, and that protects the kids. And so even if you look at our pediatric rates, we only had one child, I think, in the pediatric ICU. That was a couple weeks ago. Right now we have none. And so we're probably the only city in Texas above 500,000 that has that.
And so, again, the hope is that halo effect will continue to protect children, especially as schools are back in session. Most school districts here in El Paso have that mask mandate. A number of officials here think that is helping as well, Vicki.
Okay, Cal Perry, thank you. In a mostly vaccinated El Paso, Texas this morning.
NBC News medical contributor Dr. Natalie Azar joins us now with more on booster shots. Dr. Azar, good to have you with us. So today starts the rollout for boosters for at least part of the population. What are some of the challenges that states are facing, and also just people? There's been so much confusion. Who qualifies for these? Who doesn't? What should folks know?
Well, you know, I think probably one of the most interesting things is that there is no attestation required. So anybody can walk up to a vaccination site and say, you know, a 30-year-old and I have diabetes and heart disease, I would like to get my booster, and they can go ahead and get one. You know, I think what people need to keep in mind, folks out there who are listening, is that, you know, if you don't fall into that high-risk category, let's say, you're under the age of 65, you don't have a lot of medical conditions, but maybe you're an essential infrastructure worker or a teacher or a healthcare worker, you have to think about the purpose of the vaccine. Is it to protect you more? Because you're very well protected right now if you don't have any of those underlying medical conditions. Or could you getting sick be disruptive to your workplace? So, for example, doctors and nurses who have to stay out because they test positive, teachers who can't be in the classroom because they test positive. A lot of different issues here. And quite frankly, doctors like myself are going to be faced with these same conversations, you know, in the office. And I'm sure that I will be making many recommendations on a case-by-case basis. But of course, I worry about a lot of the folks out there who don't have a relationship with a primary care or a doctor that they can go over these, you know, issues with, and certainly could be confused about it.
And could be confusing for parents, too, with young children at home who aren't vaccinated, who might be in a higher risk situation.
Exactly.
Let me turn to CDC Director Rochelle Walensky. She said, well, she basically partially overruled her own advisory panel, right? And said, you know what, we're going to do this for 65 and over and people at higher risk, but also the folks who are front-facing. She explained her decision on CBS Face the Nation yesterday. Not sure. We do have it? We don't. Okay. So essentially, she talked about that. So, you know, she went on to really say she doesn't have an answer yet for the rest of us or people who didn't get Pfizer, when, in fact, we would be eligible for a Johnson & Johnson booster or a Moderna booster. What do you think about that? Should people be worried, or should they, as you said, they feel like they're fully and well protected until that booster comes along? Yeah, again, I mean, I think a lot of different, you know, issues swirling around here. What I have said to my patients, and I say to the broad population, is that if you have been vaccinated with any one of the 3 authorized or approved vaccines in this country, you remain very well protected against severe disease and hospitalization, again, unless you fall into one of those higher risk categories. What we would all like to have seen, and the CDC committee and FDA committee said the same things, it would be lovely to be having this conversation about Pfizer, Moderna, and Johnson & Johnson at the same time. It's just ridiculous that the timeline of this all means that we're just focusing on Pfizer. But not only that, it's mixing and matching data. Like, we're literally having to make recommendations, and there have been deliberations with a lot less information than scientists would normally like to have. But I give them a little bit of benefit of the doubt. They're doing the best that they can under the circumstances. But it certainly seems when it's reported out to the public like it's just a little bit helter-skelter. And I do understand why people feel that way. But it is a deliberate process.
Yeah.
Yes.
Well, we're talking about shots. We also talk about the flu shot. Flu season is coming up. There might be people wondering, hey, can I get the COVID shot and the flu shot? What's your advice to them?
You absolutely can. As a you know, difference from guidance when the COVID vaccines first rolled out, we did not want to administer them around any other vaccines because why? We wanted to keep it clean to really monitor and surveil for side effects from COVID-19. But you can get the COVID-19 vaccine with any other vaccine. I got my flu shot last week. I am now technically eligible for my booster, my Pfizer booster. Should I choose so this week, I can certainly go ahead and get it. Can you get them in the same appointment? Yes, you can. Okay. Dr. Azar, as always, thank you so much for the great information. Good to see you this morning. All right, we turn now to Montana and the Amtrak derailment that killed 3 passengers and wounded dozens on Saturday. Federal investigators are trying to understand why the train came off the tracks, apparently on a flat and straight section of the route. NBC News correspondent Jake Ward has more.
Alone on the track, crashed on an otherwise perfect day. It happened around 4 o'clock on a beautiful Saturday afternoon. The two-engine Amtrak train carrying 141 passengers and 16 crew members suddenly dragged to a halt as 8 cars derailed.
Oh my God, it's on its side.
All of a sudden, it was like this extremely violent force. I'm a pretty big guy, and it picked me up and threw me from my chair into the wall.
Jeremiah Johnson and his wife rushed in to help.
They were throwing ladders up on the side to get up to the windows that were broken out to go to the people that were kind of screaming inside, wanting help to get out.
They had provisioned jaws of life. They did have to cut into one of the cars to extract some of the individuals.
The accident took place in a remote stretch near Joplin, Montana, far enough from help that several helicopters had to carry the most badly injured to hospitals. Amtrak confirming 3 people were killed, dozens more injured, many put up at a local high school. Past derailments have often resulted from going into a corner too fast, as in this 2015 derailment in Philadelphia, according to the NTSB, or from a section of track either blocked or misaligned. Now, a team of federal investigators is on the ground in Montana to ask how this train came off a straight section of track on a clear day.
Why did the cars derail? If the track were straight, it strikes me that it's going to be something to do with the train cars themselves and how they connected with the track, or in some fault or flaw in the track.
On a per-mile basis, rail travel is far safer than traveling by car. And recent years have seen safety improvements like positive control systems that automatically keep trains at safe speeds. But rail maintenance is a constant challenge, and the condition of this section of track will be one of several variables investigators will examine as crews work to clear the wreckage from this typically well-traveled rail corridor.
Joe, Vicky, investigators now say that all of the passengers are accounted for. There was some question about that before now, and they describe scenes of having to actually break open the train with jaws of life in order to free some of the passengers. 5 of them at this point are still hospitalized, but the rest have been released. And now the whole question is, how did this happen? The NTSB has essentially frozen the scene in time until they can figure out how this train, again, alone on the tracks, managed to derail. Joe, Vicky?
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.